Hey guys, my name is Isabella and welcome to my channel. Before we get into today's video, I just want to remind everyone about a couple of things. First, my Patreon, where for $3 a month you can get 4 extra ASMR videos each and every month. You will also gain access to all of the previous month's videos as well. I also have an OnlyFans page, so if you think that might be something you're interested in, you can use the link down below to sign up for that. Also, down below you'll find my Instagram and Vizio page information. So my Vizio is where I make all of my custom content, so pretty much those are all the links listed down below. And lastly, just remember to like, comment, and subscribe to my channel. But now let's get into today's video. Hi, very nice to meet you. My name is Isabella and I will be your physical therapist today. So, what exactly brings you to physical therapy? Okay, so we have some lower back pain. Got it. Okay. Well, before we get started, I'm going to do a bit of an assessment on you, test your range of motion, and just make sure I have all of the necessary information before we really come up with a treatment plan. I'm sorry? Yes, this is a Bowflex machine, and it is really great for treating a lot of various issues that our patients come in for. So who knows, depending on what we are treating you for, we could end up incorporating the Bowflex into your treatment program as well. But here, come sit beside me and we'll get started, okay? Okay, so I am just going to take a seat right here. The Bowflex is sort of my office for today. Typically, I would bring you into my office. We would have a conversation in there, but due to scheduling issues, I'm currently sharing an office with another one of the physical therapists here, but not trying to bore you, just trying to explain. I don't want you to think that we don't have an official meeting space. So I apologize and thank you for hopefully understanding. Okay, so I'm just right here, have my laptop, and are you comfortable sitting there? Okay, because we're all about, well, I was going to say we're all about comfort, but that's not true because we do at times push you and try to help you overcome certain health problems you are dealing with, pain, and so at times we do push you a little bit, and you might not always like us, but we do it in a very safe and healthy environment, so we'll never push you beyond something that you can't handle, blah, blah, blah. I'll speak more on that in just a moment. But let me see. I keep a very detailed file on all my patients, but you are completely new, correct? Okay, so you said lower back pain, and who referred you to our practice? Okay. Oh, I love her. She is the sweetest. Yeah, she's the sweetest. I am a huge fan of hers. Okay, let me see. Oh, yeah, I know she opened that clinic a while back, but it's doing great. She is such an amazing doctor. Okay, so I just like to start by explaining a little bit. Every treatment plan is very unique. So if you have friends who see a physical therapist, their plan, your plan, even if you are dealing with the same maybe problem like back pain, lower back pain, your plan and their plan, it'll never be the same. You know, there's so many factors that play into coming up with a treatment plan, and I just want to put that out there because a lot of times people will come in and they'll be like, well, you know, my friend Fred is getting this plan and doing these types of exercises. I always just like to say every plan is unique. So I like to follow a step-by-step process for creating a plan that I've been using since I started my career. So that'll be my base plan, and then from there I will make it unique and tailor it to your specific needs. Also, after I complete a formal and extensive exam and assessment, I'll create a rough outline based on your diagnosis, and then every session gives me more information, more insight. We tailor it based on your progress, and we'll just fill in the details from there. So I think I saw the email come in from you regarding your past medical history, injuries, surgeries, and just any additional areas of concern. So that's great. Thank you for completing that. And now that we have that, we can continue moving forward. So I'll use that to help with my plan. So you filled that in. Do you remember if you added your medications, exercise habits, just like basic measurements, heart rate, blood pressure? I think the nurse took when you first came in. So that you should be all set with. And today we'll be doing the series of assessments to determine range of motion, strength, flexibility. And I will go over those exercises with you, take some notes after we just finish going through the basic paperwork. Oh, of course, yeah. You know, I have had so many patients throughout the years, and it really is a case-by-case basis, but I don't give up. So I know pain feels like when you're in the heat of it, when it's at its worst, that it's just never going to stop. But I promise you, I'm going to do everything in my power to try and relieve this, find what the root of the problem is. I remember this one patient, we tried so many different treatments and exercises. I remained hopeful the whole time and expressed to the patient that we would work through it together, which I think is important. I can't feel your pain, but I can feel your frustration, and I'm always doing whatever I can to help you, right? So yeah, that honestly I feel like motivated the specific patient to continue treatment, and eventually we did find a treatment that provided relief. So that was amazing, and yeah, it's so good. And it's always the most rewarding part of this job is when a patient no longer needs me. It's like a bittersweet moment because, you know, I get to know you. You become a friend. I look forward to my weekly sessions with you, and then when you're no longer here, it's for a good reason, but I still find myself sad. But it's a mix of happiness, pride, feeling very rewarded, and feeling happy for you as the patient that is no longer struggling. So yeah, it's how I know I've done my job, exactly. So in your case, after our assessment, if I do find that this is an extensive injury, which I do believe I can typically tell from this assessment that will start in just a minute, if I find that I believe it's going to be an extensive injury, a long recovery process, I will build into our plan different milestones, because I think it's important that we can celebrate the small steps, and this will help maintain your motivation and foster progress. So that is just how I like to do things. I know that was kind of a long introductory speech, but just so you kind of know where my brain is at. And now I can get started with you. So I'm just going to pull up this spreadsheet here because I'll need this to track your progress while we do these exercises. Okay. Okay, I will be right back. I'm just going to grab the dumbbells. They're actually just behind you. I'm going to get the lightest ones because I'm not trying to overwork you. Okay. So, you see, right? Okay. So what I want you to do, take these dumbbells and lean forward. Just want to assess your arm strength. Make sure there's no pain anywhere as you do this. And these are 5-pound dumbbells, so I don't think it'll be that difficult. Here you go. And then I will just be watching you. And then I'm just going to watch you. Good. Great. Good. Okay. Now sit in front of me like so. You can see me okay. I want you to wrap your arms around yourself and turn. So wrap your arms, turn, turn. Any pain at all anywhere? Okay, good. Next, you can kind of look up at me again. Okay. Now, the next thing I want you to do is just lift your arms up over your head, down by your side. Well, lift your arms up over your head, straight out, forward, flip, back, down. Okay. And then do this. Return, down, do this. Perfect. Head. Okay. And then going to have you kind of sit on your feet like this. And then I want you to lean forward on the mat in front of you and just kind of stretch, like exactly. Yep, so arms all the way forward and then lean back. Kind of like a downward dog pose. Good, very good. Perfect. Okay, and is that mat good? Because if not, you can also use this mat here. This one, patients tend to find a little softer. Do you want to use this one instead for the remaining poses? Okay, now on your hands and knees, can you tell me, point to where exactly the back pain is located? Okay, and show me the motions or movements when your back pain is at its worst. Okay. Okay. Is there anything where it is a little better, you find some relief? Okay. Okay, you can stand up now. Perfect. And let me just move this mat back over. Okay. Okay, so I think that it was a very good first session. Definitely a good assessment of you, and definitely good for learning what I believe your care is going to entail, what you are going to require. So let me go here. Oh, yes, I hope that's okay with you, but I do think you will be spending quite a bit of time with me in the upcoming months. I think you have kind of like a mid-level problem. It's definitely not a mild injury, but I wouldn't say it is the worst I've seen. From what you showed me, I think that there are definitely some things you could learn from physical therapy, yeah. And we'll definitely come up with a good treatment plan for you. I feel confident about that, but I think that might be all for today. I don't like first sessions to go too long because, it takes me time to review your chart, your file, and everything I have for you before I can really come up with a good treatment plan. So I'm going to do my best to fix you and do what I can to alleviate a lot of that back pain, okay? So stay positive, okay? Stay positive. We're gonna get through this together. I truly believe that. Okay, so I will see you next session. I'm going to email you some PDFs containing different at-home exercises you can do until we meet. These are just kind of basic, different range of motion things, and they are kind of full body types of stretching and light exercise that you can try at home. But when I see you next, it'll be a detailed plan, and we will really try to get to the root of this problem, okay? It was so great to meet you. I look forward to our next session, and I will see you then. Bye. Thank you all for watching. I'd like to end this video by giving a special shout